Thank you, first of all, for inviting me. I must tell you that I'm here on behalf of one of my colleagues, Lene Mandrup Thomsen from the Danish Rheumatism Association, and she did this survey which we are going to present. Unfortunately, Lene couldn't be here, so I'm here instead of her. I have no disclosures, and you're allowed to take pictures. A little bit about the background. What we did that we knew in Denmark there has been a very high consumption of strong painkillers, and we know that this is mainly due to chronic pain. This consumption is higher in Denmark than in the other Scandinavian countries, and within the last 10 years it has gone up from 19 to 26%. And the authorities in Denmark wanted to do something about it. They say this was too high, so they have a focus on trying to reduce the consumption of strong painkillers. And therefore they have a focus on this, trying to talk to doctors and others to try to reduce it. But in the Danish Rheumatism Association, we get a lot of inquiries from different patients. They are concerned about their chronic pain. They are concerned about all the side effects of the chronic pain, and how the chronic pain and taking strong painkillers affect their daily life and their health, quality of health, and also the social life, and also their mental health. So we wanted to go in a little deeper about this, and therefore we wanted to examine doing a survey about the influence of pain on 3 different items: the use of strong painkillers, the use of how it affects sleep and daily life, and also the mental health. So in Denmark, in the Danish Rheumatism Association, we have a user panel, we call it. It is an online group of patients. No, not really. Well, they all have some kind of musculoskeletal disease, and we did this survey last November, and at that moment we had 1,328 members in the magazine, and we received answers from 69%, so that was about 900 people, and they did this survey. And the 3 parts of the survey, as I told you, it was about the strong painkillers and whether the patients had been offered alternatives after the authorities wanted to reduce the consumption. And also the second was about the quality of sleep and how the influence of pain was on their daily life. And the third thing was, of course, the impact of pain on the mental health. So when it came to the results, the first results showed that actually from this panel with 900 people with a RMD in Denmark, 86% actually had pain. They had pain for several times a week or daily, and of these, almost half of them had used strong painkillers within the last year. So, and also a very high amount, almost 80%, said that they has not been offered any alternative to the strong painkillers. So this is a problem for patients, that when the doctors try to reduce the consumption and they are not offered any alternatives. So of course what the patients did, 18% of them already acquired strong painkillers outside the healthcare system, trying to get them in the black market or other places, and almost 20% said that they have thought about acquire painkillers from somewhere else. The second results about the influence of sleep on pain. Well, a lot of these people in the 67% said that they rarely or almost never feel well rested after or have a nice sleep at night So this is a problem for many people, as you can see. Also, quite a high figure of them take strong painkillers and use the strong painkillers to try to fall into sleep easily or have a better sleep during the night. So, and also 69% said that they experience that their quality of sleep has the pain has a negative effect of their quality of sleep. So it's both ways. When you are in pain, you have a bad sleep conditions, and then if you are not well rested, your pain gets worse. So the third results, which were the most scary one actually, it was the influence of pain of the mental health. We saw that 58% said that they sometimes feel that everything seems overwhelming and not really worthwhile. So a lot of them didn't want to be, almost half said that they didn't have wanted to be social with other people, didn't want to go to meet other people. And what scared us the most actually was that 11% of these people said that they have thoughts about taking their own lives. So this is 11% from the 900 people. What we did, well, in conclusion, you could say that there's a large number of people taking strong painkillers, and too many have not been offered any alternatives to their strong painkillers, and a lot of them feel that the impact of their pain the pain has an impact on their social life and also their quality of life, their sleep, and the mental health. So what we did with this study was that with these conclusions, we contact the political authorities in Denmark and said that, well, it is perhaps you think that it's we need to lower the consumption of strong painkillers, but you have to put something instead, because the patients can, if they have chronic pain, they must have something instead. And this led to that the authorities put down a working group. This was the first step, and the Danish Rheumatism Association has a place in this working group, where we try to make a national strategy to lower the consumption and to find a new strategy on management of pain. So this is one thing, and we hope that this work should be finished within this year. And the other perspective we had was that we would try to do something in the association. So we set up a new project where we have a specific method called TRE, T-R-E. It stands for the tension and trauma releasing exercises, where we try first with small groups of people with chronic pain to a new method of reducing this pain and managing the pain through releasing exercises. And we have just started trying this for 2 groups and a pilot study. And if it is a success, which is formally shows, it seems to be, we haven't evaluated all. We wanted to do more of this so that we could try to offer a new way of pain management within patients with chronic pain. So thank you for your attention.